let's wrap up our brief overview of the digestive system and its fun activities with an overview of a few of the more common disorders of the system. I hope this never happens to you or me, because choking can be terrifying. What happens is that instead of food going down your esophagus, it actually gets lodged in your trachea. Classically, the sign which tells you that someone has a problem with choking is they will point at their throat and be unable to make any sounds. Please get trained in how to use the Heimlich maneuver in order to remove that food. How do you prevent it in the first place? If you're chowing down on a meal and you're by yourself, takes pretty small bites of food. Make sure that you're chewing it thoroughly. Don't be talking or laughing or exercising or drinking when you're either eating or breathing hard. This shows you a Heimlich maneuver. You can actually apparently use a chair if you're by yourself to do the Heimlich maneuver on yourself. I would look into that before you try it. Do a little investigation, so if something happens, you're prepared. Vomiting is a way that we basically expel something that is upsetting your GI tract or potentially causing harm to your GI tract. The issue with excessive vomiting is dehydration, which can happen pretty quickly. There are eating disorders, which are a mental health issue, not something to be scorned or mocked, that cause people to purge the body of the food that they've eaten. If you have an eating disorder, please seek help. You can contact me privately, and I will help you find the appropriate support if you are dealing with an eating disorder. Diarrhea, if you've had kids or you've had pets or you've had some sort of GI bug, sure enough, you've seen this, you've lived through this, oh boy. Frequent understatement, loose and watery stools, understatement. And they tend to be fairly copious too. Commonly caused by things like colitis or IBS. If you have a GI infection, it can trigger them too. How do you deal with them? How do you try and manage them? Rest. Make sure you're drinking lots of fluids because dehydration is an issue with diarrhea too. And if it's lasting longer than a day and a half, 2 days, make sure you're checking in with your doctor because of the potential harm that excessive diarrhea can do to the body. The opposite of this, everybody's favorite, constipation. It's not only just eating a high fiber food that can cause constipation. Sometimes it's triggered by various medications, for example. The problem with constipation is that if it lasts over time, it can cause things like hemorrhoids, or more scarily, diverticulosis or diverticulitis. And it tells you exactly what happens in diverticulosis or diverticulitis there. So how do you prevent becoming constipated? Make sure you're eating a lot of fruit and veg. In other words, a lot of fiber. Increase your intake of fluids. Make sure you're exercising, you bet, because exercise helps move food through your GI tract. And when you get the urge to defecate, don't wait. Find a bathroom, find a toilet. Sometimes you have gas buildup, which can cause belching. What a joy. Try and eat a little bit more slowly. Make sure you're chewing your food thoroughly. You see a theme here? Relax while you're eating. Don't eat and exercise at the same time, or don't bolt your food. And avoid foods that you think are triggers. Hiccups are usually triggered by eating food or drinking too fast. And sometimes they just are idiopathic. In other words, it's a big fancy word for saying we don't know what triggers them. Sometimes they just happen. Heartburn, acid indigestion, acid reflux. Remember, the stomach is really acidic. The contents of the stomach, pH of 1 or 2. That acidity, that acidic material actually has, in the case of heartburn or gastroesophageal reflux disorder, that acidic material moves backwards up through that lower esophageal sphincter or that cardiac sphincter or the gastroesophageal sphincter back up into the esophagus. And you will feel extreme burning or sensation of chest pain. Please remember this, heartburn may actually be a symptom of a heart attack. So if you have heartburn and you're not used to having it, don't think, oh, it's just heartburn, because you may be having a heart attack. Red alert. And it can happen, heart attacks can happen in anyone of any age. So how do you help reduce gastric reflux? You'll see a theme here. Try it. How's that for English? Consume small meals. Try and drink more liquids in between those meals. Sit upright while eating. Don't try and be like a Roman and lie down. Wait for at least an hour after you've eaten before you lie down to take a nap or sleep. Wait a couple of hours after eating before you are exercising actively and vigorously. Refrain from wearing tight-fitting clothes. Avoid foods that might be triggers. And if you are overweight, try and reduce some of your weight. Heartburn is not fun. I've had it. Ulcers. So you can either have peptic ulcers in the stomach or duodenal ulcers in the small intestine. And it used to be that everybody thought that the acidity of the stomach caused stomach ulcers. Truth of the matter is that most stomach ulcers are caused by a bacterial infection, and the bacteria is H. pylori. H. pylori. So, how did they find that out? There were these two guys, these two researchers in Australia, who became convinced that ulcers were caused by bacteria. And the medical community laughed at them. One of them used himself as a guinea pig, made up a cocktail of H. pylori, which he drank. He gave himself stomach ulcers, peptic ulcers, and treated himself with antibiotics and cured himself. I just love that story. If you are diagnosed with ulcers, particularly peptic ulcers, you will be prescribed antibiotics. Take all of your prescription. Do not say, oh, well, I feel better, I'm going to stop taking these. Take all of your prescription anytime you are prescribed an antibiotic. This is why. If you stop taking your prescription halfway through its course, you have killed off the weak bacteria. You have not killed off the strong bacteria. And that strong bacteria say, whoa, we're still alive. Let's reproduce. And hey, by the way, we haven't been affected by this antibiotic. So, we're now resistant to that antibiotic. And that's basically what happens. So should you be given a prescription of antibiotics for anything, take it all. Try and avoid caffeine and alcohol. Minimize aspirin and ibuprofen use. And quit smoking. Pretty straightforward.